Hello everyone, it's Dr. Greg Murphy coming to you on Monday, April the 13th from Eastern North Carolina. Wanted to have another discussion about the COVID-19 pandemic. It is no doubt that in this state and in this nation we are facing the greatest challenge that we have had since World War II. In 1918, the Spanish flu took the lives of over 50 million people worldwide. There have been multiple models recently and multiple experts that are trying to predict how many lives that this tragic pandemic will take here in the U.S. and abroad. We are now fighting an enemy that we cannot see with weapons that we have not yet made. And I say the following as not only as a physician, but also as a member of Congress, that we, like the rest of the world, are literally building an airplane while we're flying it. We are all in this together. Where are we now? Social distancing wasn't even a term that was used much a year or so ago. But now companies have sent their workers home to telecommute. Teleconferencing is the new normal. Obviously, work efficiency cannot nearly be what it was previously. The entire purpose, and we've been talking a lot about this, about flattening the curve, was not only to save lives, but to not overwhelm our medical facilities. We are still short on some resources and we must catch up. But as we should do in all things, we should examine what we are doing while we are doing it so we know how best to adjust. And I'm going to give you an example that I've used a lot of times in medicines. We always talk about the risks and benefits of treatments and surgeries. In the past, when treating cancer, all we have had is chemotherapy. Most people know that chemotherapy is essentially a poison. It kills the bad cells, but also at the same time can kill good cells. Such is the same with our interventions. In an effort to contain the virus, we have hurt institutions in this country and partly crippled our economy. But now in medicine, we have targeted therapies that work to just kill the cancer cells and to try to leave the good cells alone. Thus, we must search for a target intervention now with our economy and our institutions to keep the virus at bay, but allow us to gain some sense of normalcy. It seems like it's been an eternity since we've been waging this battle. The battle has physical scars like hospitalizations and deaths, but it also has a lot of scars that you cannot see. Anxiety, worry, frustration. Unemployment was previously at a 50-year low, but now 16 million people in just the last 3 weeks have filed for unemployment. The unemployment rate previously hovered around 3.5% and is now close to 15%. This nation responded to the crisis by washing hands, wearing masks, social distancing. Businesses closed down, churches were shuttered, and lives have been put on hold. We did what we had to do, and it was the right thing to do at the right time. Yet now, given the economic devastation that some parts of this nation are facing, and as well as to the virus and from the response to the virus, it is altogether fitting that we discuss how we best can move forward. There is no perfect right answer, but we simply cannot hide and shelter in place until we have a vaccine. We must realize that we are creating poverty and that in that also there is a healthcare vacuum. Both of those will lead to unintended illnesses and unintended deaths. Please understand, I am not criticizing by any means what we have done. I have been fully supportive and been pushing for it. I'm just trying to offer some thoughts on how we best can move forward. There is not a one-size-fits-all model. We have different geographic challenges. We're in rural Eastern North Carolina. We have different populations, those who are most at risk, and those things must be considered. There are 4 things that we must accomplish before we return to a new total normal. We need medications that are used to treat the virus. We've been working on those, but still are a ways off. We also need point-of-care testing for the virus so we can see in that moment, does that person have the virus or have they been already exposed to the virus, thus have developed antibodies. We also need something called surveillance testing. Surveillance testing is going out in communities and seeing if the virus is present there or see if people have been exposed to the virus and have antibodies. And most importantly, we need to have a vaccine. But in the best of circumstances, that is 9 months away and maybe further. So unfortunately, many of these things that need to be accomplished are at the best months and if not years away. But then what can we do now to bring some sense of normalcy back? Well, it's important then to look at those most at risk for illness and most at risk to succumbing from this virus. And then we can extrapolate out from that. So let's look at statistics that we do know. We do know that over 90% of the individuals who get sick from this virus are over 25 years old. And it's also clear that the majority that are most vulnerable to the virus, of succumbing to the virus, over 80%, are usually 65 and older. And so until we get a vaccine and until we get surveillance testing, those individuals may have to stay home or risk traveling really at their own risk. I would suggest that individuals under age 65 who also have significant chronic diseases such as kidney failure, bad diabetes, heart conditions, lung conditions, those individuals need to stay in place also. So where does that leave us? My suggestions are those to age 65 and younger who do not suffer from chronic disease. They will not be immune to the virus. You will still get sick from the virus, but they're the ones who are at least at risk from succumbing to the illness. We have intervened in Congress to try to stabilize the economy, but we must begin discussing and planning for ways to return to some sense of normalcy in business and daily life. We simply cannot keep printing money in Washington and hoping that this will go away. So my suggestions are the following. First and foremost, we must continue doing what we are doing. That's washing hands, wearing masks, continue social spacing. But let's talk about small businesses such as beauty salons or barbershops. They should be able to open back up. They need to stagger their appointments. They need to make sure that their chairs are 6 feet apart. They need to make sure that their customers and themselves are wearing masks. They must sanitize all surfaces that anyone would touch multiple times a day. Restaurants, for the most part, should be able to open back up with, again, very strict controls. Seating must be 1 table apart, no greater than 4 individuals at 1 table. All the working staff must wear masks and gloves. Obviously, continue the robust takeout industry that has really popped up. Churches are the challenging one, and this is the one which really has hit home to a lot of individuals. A lot of individuals who are over 65, that is the biggest point of their week. But we have to be careful for them and ask them to continue to watch services online. But for those younger, wear masks. Be in space in pews, separate apart. Folks on one side of the pew and other folks on the other side of the pew. Again, maximum of 4 individuals. There may be a way that we have to have more services during the day to keep these people apart. You know, as for other small businesses, they need to continue to follow the practices of above, but they should be allowed to open back up on a limited basis. You must limit the number of individuals that are in the store and make sure it's a requirement that they come in wearing a mask. Let's talk about agriculture. I've spoken with a lot of farmers recently, and they have crops that in the field that are just sitting there. They're not being able to be harvested, and this is the time where planting needs to occur. Again, if we get the workers back, social spacing, hand washing, wearing masks, we need to get the agricultural economy going again. They were having a tough time to begin before all this, and we obviously need to be able to put food on our table. We cannot continue to cripple this part of our economy. Let's talk about healthcare. Hospitals and physicians' offices have closed down. Elective cases have been across the board canceled. This has crippled many hospitals who rely on that income to stay solvent, as well as many physician practices. We cannot allow them to fail, but we can't also bail out every single one. Obviously, we have to have point-of-care testing if we're going to really get back full-time. This is to see if someone has had the virus or they've been exposed to this. But until we do that, we can use some common sense measures and what we have learned to slowly open up our healthcare economy. I feel that a great number of individuals who were getting important routine care are not getting that now and will be therefore creating a lot amount of illness and death in the next few months. Those who needed regular mental health checkups, cancer evaluation, heart disease evaluations are not getting them. It's very easy for us in the healthcare field to have tunnel vision, but we have to realize that there are other medical conditions that are not being attended to that we need to pay attention to. You know, one example, and I'll just take a small example of this, a very low risk population are those young kids under age 2. Our ENT doctors, in my opinion, should be allowed to put ear tubes in. They don't have an endotracheal tube. They don't get intubated. It's a very quick population. It is a very low risk procedure. We shouldn't be using up PPE while we're doing it. Cancer evaluations and treatments should be carefully evaluated and continued with. I know some people have had to stop in their cancer treatments or radiation treatments or workups for cancer. We can't do that. We have to be smart about this. Obviously, the hard part about this is a lot of individuals are those age 65 and older. But we said this is a discussion. We must begin these things. We cannot simply just focus on one disease process. They're hard things to do, but I really have great confidence in our medical community with sharp minds, intelligent folks, and caring individuals that we can come up with some common sense approach. Let me tell also one thing that's very important. Health insurance companies who have been collecting premiums for the last several months, while outpatient visits have been down 90%, need to refund premiums back to their customers. There is simply no reason whatsoever that they should be sitting on that much cash and having not paid it out to providers. They need to give that back to the people who paid the premiums. I would also submit that we should allow outdoor parks to open up, as long as we maintain that social distancing and limit it to 4 individuals. There is no reason, in my opinion, to keep people out of fresh air. Museums, just like restaurants, should be a part of the discussion, keeping people spaced apart and limiting those. Large businesses are going to have to look at this on a case-by-case basis. We have a lot of boat building places here in eastern North Carolina. Those individuals are not close to one another. They're different than factory line workers. Again, that's a discussion that's one that we should entertain. All of these things are not to say that we should open up everything. I am not advocating for that at all. We have to keep wondering how long we can safely keep these measures to flatten the curve. They have undoubtedly saved thousands and thousands of lives, but at the same time have undoubtedly damaged our economy and put our livelihoods at great peril. This demands a thoughtful and intelligent conversation. There are risks and benefits of either approach. And of course, there are going to be those who condemn no matter what we do and question whatever avenue we've taken. Those people are not helpful to the discussion, and I believe are just seeking to divide this nation. So let's ignore them. Let's get smart minds together. We have still to keep our mind first and foremost the health of our country, but we have to look also about the welfare of our country, the individuals, the small businesses who need to get back in business, not only for economically, but for their sanity and for other reasons. So God bless. These are just a few points of discussion. I think it's a discussion that we need to have today at the same time as we try to save the health of our nation. God bless and thank you.